Dear colleagues, my name is Rita Vajna. Let me introduce my 12 months project progress. The title of my big PhD topic is Clinical and Pathophysiology of Polycystic Ovarian Syndrome. I am a PhD student. I'm working on the Barrow Street Department of Obstetrics and Gynecology in Semmelweis University. My supervisors are Szabolcs Várbíró, Levente Sára and Judit Hetesi. My scientific methodology supervisor is Fanny Mesnerich. My mission is finding the best therapy option for higher ovulation rate, endometrial thickness and pregnancy rate in women with PCOS. My vision is, with the best therapy, more women with PCOS can have a child. That is my specific goals. The title of my first topic is Strong Early Impact of Letrozole on Ovulation Induction Outperforms Clomiphene in PCOS Women. This is a systematic review and meta-analysis. The title of my second topic is Investigating the Efficacy of Herbal Remedies on Metabolism and on Endocrine Status in Women with PCOS. This is a systematic review and meta-analysis too. First, I would like to speak a little bit about the background. The incidence rate of PCOS is between 3 to 10%. The PCOS is the #1 cause of infertility. The most important problem with this, the high testosterone level, the irregular periods that leads to infertility. We have two good PCOS options for follicular stimulation. The first one is clomiphene citrate. This is an estrogen antagonist. But this drug has many side effects. The most important is anti-estrogen effect. This is endometrium thinning. We have an alternative options. The name of this drug is Letrozole. This is an aromatase inhibitor. This drug not show anti-estrogen effect. And the patients tolerated it better, and the pregnancy rate, ovulation rate is higher than clomiphene citrate group. The clinical question is Letrozole superior to clomiphene citrate in treatment of infertility in PCOS patients? We used PICO framework. The P is women with PCOS, I is Letrozole, C is clomiphene citrate, and O is ovulation rate, endometrial thickness, and pregnancy rate. Our hypothesis is Letrozole therapy is superior to clomiphene citrate therapy in the improvement of ovulation rate, endometrial thickness, and pregnancy rate. I made a systematic search with the following search key and the flowchart of selection, and I found 25 eligible full text. I have 8 outcomes, and I would like to present you my 4 biggest outcomes. The first one is endometrial thickness. We can see on this slide when a patient uses Letrozole for ovulation induction. In this case, the endometrium will be thicker than a patient uses clomiphene citrate. This is very good because when the endometrium is thicker, the embryo implantation will be better. The second outcome is ovulation rate. We can see that among Letrozole patients, the patient have bigger odds for ovulation than a patient use clomiphene citrate for ovulation induction. This is very good because without ovulation, the patient will be not pregnant. This outcome is statistically significant and clinically relevant. My third outcome is pregnancy rate. We can see on this slide when a patient uses Letrozole. In this case, this patient have bigger odds for pregnancy than a patient use clomiphene citrate for ovulation induction. And this result is clinically relevant and statistically significant too. Our fourth outcome is resistance index and pulsatility index of subendometrial arteries. We can see that when a patient uses Letrozole for ovulation induction, the resistance index and pulsatility index will be lower. And with lower resistance index and pulsatility index, the circulation in the uterus cavity will be better, and therefore the embryo implantation and embryo development will be better too. Okay. We have some strengths and limitations too. The first one strength is we used only RCTs to our article. And this article is the first meta-analysis to comprehensively assess the resistance and pulsatility index of subendometrial arteries. The limitations was that in the RCTs were no sufficient data on live birth rate, and different drug doses was used across the studies. Conclusion is thicker endometrium, higher ovulation and pregnancy rate, and better subendometrial circulation in letrozole group compared to the clomiphene citrate group. This is my manuscript status. I submitted my article on 30 of August in the third journal, and at the moment I'm waiting for the answer. The title of my second topic is Investigating the Efficacy of Natural Products on Metabolism and on Endocrine Status in Women with PCOS. This is a systematic review and meta-analysis too. The background is very similar to my first project. The PCOS affects 1 in every 10 women worldwide. The most important problem with PCOS is hyperandrogenism that leads to obesity and insulin resistance, and finally it causes infertility and diabetes mellitus. In this case, the first-line treatment is metformin, but this drug has many side effects, and we have alternative options. There are natural products. The natural products can enhance the positive metabolic and endocrine effect of metformin. For example, increasing the estrogen level and anti-androgenic activity and the like. With them, less metformin might be sufficient. Our aim is to compare the effect of natural products with metformin or placebo regarding metabolic and endocrine status in PCOS patients. Our clinical question is, can natural products improve the metabolic and endocrine status in PCOS patients? Our PICO framework is P is women with PCOS, I is natural products, C is metformin or placebo, and O is different metabolic and endocrine parameters. Our clinical implication is natural products as an effective therapy to improve metabolic and endocrine status in PCOS patients. I made a systematic search with the following search key and the flowchart of selection, and I found 55 eligible full text. This is my second project progress. This is the summary, and thank you for attention. I would like to close my presentation with the following sentence: what you can't explain simply, you don't quite understand. Thank you very much.
Thank you for your presentation. I'm just wondering if you have investigated the side effects, the safety profile of the two drugs in your first project, because we can see well the efficacy, but the other side is also important.
We not summarize the side effect of these drugs. We make in our research, we summarized the effect of clomiphene citrate and letrozole of ovulation rate, pregnancy rate, and endometrial sickness has not make the examination with the side effect.
Hi, thank you for the presentation. I'm asking about your second topic, whether there are plans about, there are many natural products, and these are usually not pronounced to a certain standard, so they are very heterogeneous. How do you plan to deal with that aspect of the research, or what do you expect during the data extraction and the problems that might arise?
Thank you for the question. I can examine the cinnamon capsules, the berberine capsules, and with 5 other products. With the other products, I will make a systematic review because the other products we have not enough RCTs with the meta-analysis, but with 6 products we can make meta-analysis.
Thank you.
Thank you.
Congratulations on your work. I just want to ask concerning the second project as well. I have seen that you included, for example, vitamin E in your search as one of the domain you search for. Maybe just an idea. What about the vitamin D? Because, for example, in my study, it showed efficacy for insulin resistance in patients with non-alcoholic fatty liver disease. So, have you included also vitamin D or the other vitamins? Thank you.
Okay. Thank you for the questions. I will examine the vitamin D too. This is very good for the PCOS patient. This can regulate the glucose metabolism, and they can enhance the positive effect of metformin, insulin sensitivity effect, and help to the menstrual cyclicity too. Thank you very much.
Thank you for the presentation. I was wondering about how you're going to minimize the confounding variables in your analysis, because there are many strategies, for example, exercise and a good nutrition. And how are you going to minimize this confounding in these interventions that you are investigating?
Mm-hmm. Thank you for the questions. We summarize the RCTs when the patients use only natural products with metformin or alone, and when the patients make exercises in these RCTs, I not include in the studies. I will not include.